The future of orthodontics is evolving and changing every day. But although the way to achieve practice growth has changed, there's never been a better time to be an orthodontist. Let's get into the minds of industry leaders, forward-thinking orthodontists, and technology insiders to learn how they see the future of the orthodontic specialty. How will digital orthodontics, artificial intelligence, clear aligner therapy, remote monitoring, in-house printing, and other innovations change the way you practice? Join your hosts Dr. Leon Klempner and Amy Epstein each month as they bring you insights, tips, and guest interviews focused on helping you capitalize on the opportunities for practice growth. And now, welcome to the Golden Age of Orthodontics with the co-founders of People and Practice, Dr. Leon Klempner and Amy Epstein.
Welcome back to the Golden Age of Orthodontics. I'm Dr. Leon Klempner, and as always, joined by my co-host and daughter, Amy Epstein. As loyal listeners, you know that we like to explore all the factors impacting the profession, and we try to ask hard-hitting questions and bring guests with all different backgrounds, products to offer, and perspectives on the industry. But there are a couple of select companies that we've chosen to partner with because of their superior technology, business model, and importantly, commitment to the orthodontic specialty. uLab is one of those companies.
Our sponsors allow us to carry forward the work we do to bring light to complex and nuanced factors that impact our industry. And for that reason, we've decided to dedicate an episode to our friends at uLab so that they can tell you about their industry-disrupting technologies. But instead of our usual executive lineup, uLab thought it would be fitting to hear from a real provider who uses their products day in and day out so that you can learn how uLab has benefited their practice. So today we're going to welcome Dr. Skye Naslenas. And Dr. Skye earned her Master's of Science and Orthodontic certification from the University of Toronto. She's been a presenter and an invited guest at several of the industry's top events, including the annual meetings of the CAO, the AAO, and the American Cleft Lip and Palate Association. And on that topic, Dr. Skye also works at the Hospital for Sick Children, where she works with children with craniofacial anomalies, cleft lip and palate, and other developmental challenges, which I don't know if Dr. Skye, you'll learn about it too, but my dad also has some history and experience in that space, so you share that in common with him.
Yeah, I love that about your background. Tip of the hat for doing that. We appreciate that.
So Dr. Skye, welcome to the show. We're so happy to have you here with us today.
Thank you for this glowing introduction, and I'm glad that I can relate to one of my hosts here on the screen over the cleft lip and palate field. But more importantly, I'm happy to share my experience in using uLab aligners.
Yeah, well, why don't we start there and tell us about your journey in general, providing aligner therapy to your patients, and then we'll talk a little bit of how uLab comes into play.
Sure. So I think like many of my generation orthodontists who had been classically trained in bracket and wire technologies, and almost exclusively that was our education as we were graduating our residencies. I had to learn aligner technologies that became available to orthodontics as a field. Actually, after my graduation, I didn't have a lot of exposure to aligners in any meaningful way while in school. So some of the players that were on the market back then, Invisalign was a known one and probably had a bit of a monopoly on the entire aligner market. I think it was a brilliant and timely introduction of alternative to the traditional train track braces into the market for many reasons, mostly because the changing of the landscape was moving from children treatment towards adult treatment. Many of the adults who have gone through braces as children were experiencing relapse, and they weren't going to go through train track braces again to have a little bit of correction done. So aligners came into the orthodontic market as a game changer this tumultuous force where they made orthodontics available not just to children, they made orthodontics acceptable to adult population as well, much more readily than traditional braces would have been. So the clear aligners were here to stay, and that became very obvious very quickly. So providers like myself who had graduated from an orthodontic residency program without having a lot of exposure, the onus was on us to kind of grab the bull by the horns and join the revolution. So I learned aligner treatment on my own with the support of whatever companies I was working with, applying the classical principles of orthodontics. And I think that was also a huge benefit in terms of rather than a general dentist who the concept of aligners was for them, you scan the teeth, you send them into space, you get aligners and aligner straightened teeth. To many of us who are orthodontically trained, we realize very quickly that it's not the plastic that's straightening the teeth. It's actually the orthodontist that's straightening the teeth. So, Invisalign at that time got very mixed reviews. It was, oh yeah, Invisalign didn't work for me, or Invisalign didn't work for my friend. And my answer to that always was, well, the provider of Invisalign perhaps wasn't an orthodontist. The compliance that was there probably wasn't emphasized. So there were a lot of caveats that the general public, as well as the dentists, the providing dentists, had to be educated upon. So there was this whole evolution as to where the aligners fit into the grand scheme of things, who should be delivering aligners to patients. And that's where it became about case selection. And that's where the great divide became between dentists doing much more orthodontic treatment, not just orthodontists providing orthodontic treatment. So for better and worse, in terms when it comes to our profession, all of a sudden aligners almost made it manageable for dentists to treat some simpler cases. The bigger picture of it was that orthodontics was made available to a larger scope of people. And I think that benefits going forward, that benefits our specialty and our profession overall. Whether we have to give up some cases to general dentists, you know what, that's okay. There is no reason why a well-trained general dentist cannot provide a little bit of relapse restorative treatment with aligners. A well-trained dentist will also recognize when the referrals are appropriate to the orthodontist. So aligners were a disruptive force on the market in terms of, again, making it available to a larger segment of the population, making it available to a larger segment of providers as well.
Yes, Guy, you and I had a similar path in terms of clear aligner therapy. Because I was an early adopter. I was actually in the very first training course. It was in New York City, and I think it was 1999. I don't remember. But basically, if you were going to do clear aligner therapy, you were going to do it with the leading brand because there was no real other options. So I'm curious. I know that you've switched over to uLab, and I'm curious as to what are the reasons you've done so? What was your thought pattern? What were the features that were attractive to you? I mean, why uLab over the leading brand?
So I think uLab has done several things right that I recognize in a company that is truly going to be in a partnership with orthodontists. So the attractive feature is that they offer uLab services, uLab aligners exclusively to orthodontists. We all, as a profession, had a bit of a gripe that Invisalign marketed firstly to the general dentist before they marketed to the orthodontist. So there was a big difference in there. I felt like I would be offering an exclusive product to our profession. uLab management team, developers actively listened to orthodontists and their gripes about the leading brand shortcomings. So when they launched their product onto the market, it addressed all of the shortcomings that the leading brand had, as voiced by multiple times by orthodontists. So it's almost like patient going for a second opinion. So they tell you exactly what they didn't like about the first opinion. So it's very easy to fall into favor as a second opinion. Well, of course, you're going to ameliorate everything else that the other provider didn't do. So I feel like uLab capitalized on all the shortcomings that were pointed out by over a couple of decades of treating orthodontists, and they've put that into action, and they've addressed our concerns, such as we are the technicians. We're not limited by tooth movement and any algorithms. We can overwrite artificial intelligence and the algorithms that are set out as a baseline, which is great. But also, I don't have to communicate over somebody who has less knowledge perhaps in areas of tooth movement in order to execute the movements that I want. So the process of case setup became very easy, very dynamic, and under my full control. I could order 5 upper aligners, I could order 2 lower aligners, I could order passive aligners. I mean, there was nobody, I didn't have to go through any red tape. You had a dedicated technician to set up your cases if you were an elite provider with Invisalign, which was great. Now I don't have to, and then, after a while, the designated technician went away, segues into DAs. So again, and I am training my DAs to set up my cases. I know they will be reliable. So uLab had so many features that Invisalign did well as a leading brand, as a leading provider of clear aligners, but they took it to the next step. And they've addressed all the gripes and concerns that we had with the leading provider brand.
Mm-hmm. I hear a lot about control as a benefit and flexibility too. Can you talk a little bit about, you said 5 upper, 5 lower. I've heard from uLab the word sprint. Can you tell us a little bit about ordering and sprints and how that's a benefit?
Yeah, talking about, and I think I heard you say print, right? Printing aligners?
No, sprints. Ordering like in short, small groups of aligners at a time. Yeah.
I misheard, because I want to talk about printing aligners in-house as well. So yes, you can order. So some of the patients that are coming in, and they're younger patients, the parents or the patients themselves will say, you know what, for example, I'm not sure how the aligners would feel in my mouth. Can I just order a few without having to commit to the full treatment? So you would order this, 2, 3, 4, 5 aligners at a time for the patients to try. Some of them don't want necessarily maybe to go 2 years of treatment to perfection. And they say, you know what, I would like to see how this goes and maybe, have partial treatment or only treat the 6 front teeth. So again, we're able to stage treatment based on patients' needs. Essentially, Smile Direct Club wanted to do that. However, it was unsupervised by any doctors. But here again, you have the flexibility without committing to a package of aligners that Invisalign was offering. Let me order just a few little aligners. Again, no commitment to me, no commitment to the patient. And patients these days like to be involved, and they like to be in control of their own treatment, and I can actually work with those demands without compromising my knowledge or financially putting the patient at a risk that, you may commit to a full treatment, but you may not like the feel of them.
Yeah. I mean, I imagine that too, ordering in small batches like that would help with, for example, if you'd like to finish a case in a liner, a brackets case, brackets and wires, and finish in a liner, something like that becomes more feasible.
It's opened up a whole scene of you can use the aligners to finish cases, what positioners used to do for us. You can use the aligner technology to order retainers and night guards based on the thickness of plastic that you're choosing. You can do surgical cases and use aligners as surgical splints. You can use combination therapy whereby currently I have a patient who will be traveling for a year and he's been waiting to start treatment. So very deep bite. So I said, you know what? Wear aligners for a year. We'll open up your bite. When you come back, we'll put lower braces on to expedite treatment because it's quite a deep curve of speed, but the teeth will move easily into position. Your treatment time becomes much more effective and efficient. And more importantly, you can do some of the work already while you're traveling with aligners on. Call me on Zoom. I will check your teeth. We will walk you through it. So it's an amazing tool, bringing orthodontics to the patient's lifestyles, accommodating that, and making relapse cases or treatment cases possible.
Yeah.
You mentioned printing and in-house printing, 3D printings. The cost of printers have come down. I know that a lot of orthodontists are experimenting with, seeing if they could print their own aligners. From an economic standpoint, seems to me like a lot of work and not very cost effective, but it's out there. I'm curious as to your feeling about 3D printers and how it fits in or doesn't fit into the workflow.
So that's a great point, and that's an advantage. Again, it's available to us, and I know there are some orthodontists who are doing it quite successfully and printing in-house aligners, and that's wonderful. I tend to agree with you. Again, whether it's our classical training and classical approach to practice management, I always feel like if I don't want to be that person pressing all these aligners all day long, why would I ask any of my team members to do that for me all day long? So I do feel that in our practice, the way printing aligners fits into our office best is if we have a patient who is eager to start or has a wedding coming up or a trip coming up, and they come in today, we discuss, we can send the patient. I can scan them, I can set up their uLab case, I can print the first 3 aligners and say, please come back and pick them up tomorrow. It will take you over the next month while you're away on holiday. The rest of the aligners I order from uLab when the patient returns from the trip. They're ready to proceed with the rest of the aligners seamlessly. There is no wait time. There is no hiccups in terms of, I wanted to really take these aligners with me. So I kind of use it as an way to get my patients going and underway, especially the ones that are under time constraints.
Yeah. And, we spend a lot of time talking as marketers. We spend a lot of time talking about how with the business opportunity of reaching adults for simpler or minor tooth movement, you have to also meet them where they are in terms of the workflow of engaging with your practice. And I've heard you say a few times, fitting treatment into their life and making it seamless for them. And we completely agree with that philosophy. And we offer some technologies to make that happen in terms of communication. But it sounds like you really have it down in terms of listening to your patients, your adult patients especially, and working orthodontics into their life. And I think that's a big part of treating adults that we don't actually talk that much about.
And this was one of the hard lessons and perhaps necessary lessons that I feel COVID time has taught many of us. So my patients who were in brackets and wires were actually literally put on hold because our clinics were closed for a large period of time. The larger period of time, or the longer period of time that followed, was patients didn't want to leave their house, didn't want to be exposed to the second, third, and fourth waves of COVID and different strains that were coming around. So we've had broken wires, we had poking wires, we had patients that really were arrested in their orthodontic progress during this time. Our aligner patients, however, we very quickly introduced a virtual care platform whereby they would call in, they would send me pictures. I would make sure that the aligners were fitting. They would either pick up the aligners at the door of the office, or we would mail these aligners directly to their home. So their treatment continued seamlessly throughout the time of COVID. And what better time to do this while we're all under masks and still at home and, wearing our elastics full time. A lot of our adults will start rolling their eyes when I say, you really have to wear them 22 of the 24 hours a day. And if I say on top of that, you should really be wearing the elastics, they're like, Sky, you're asking me to do a lot here. But during the time of COVID was some of our most successful treatments because they were not constrained by being in the workplace or feeling embarrassed. And so it kind of stayed with me a little bit. And now with people traveling, people working partly from home, people moving from big cities into remote locations, they still want access to perhaps the availability of city providers who tend to be more experienced or more qualified or have access to cutting edge technologies. But now they're getting that treatment from a remote location without having to be in the office so often. So again, the timeliness and the flexibility that aligners, and in particular, my preferred choice is uLab, has brought to us is tremendous. What if the patient finishes aligners on the top quicker than the bottom? You order more aligners on the bottom and they're so happy not to have anything on the upper teeth because that's what actually shows. So again, without having to be slotted into, a comprehensive package, a moderate package, an Express 10 package or 15 or whatever the packages were, it got really confusing by the end of it. You need more aligners, you pay per aligner, you get however many aligners you want. It's so simple and it's so elegant in its simplicity, and that's also so attractive to many of us orthodontists.
For sure. So we could delve into a couple of things. There are so many directions that we could go in, but I'm gonna put a pin in myself for a second, and just invite one of our callers, our listeners, to ask a question, as we typically do on our show. So I'll go ahead and let you see and hear our listener now.
Hi, Dr. Naslenas. This is Dr. Eric Wu from Palo Alto, California. I understand there's been a recent software update to uLab, and was just curious what your experience has been with it so far.
So this speaks to my original intro, as I said, why I switched from Invisalign to uLab. uLab listens, uLab puts it into action. So this latest upgrade was tremendous in terms of how the software was presenting on the screen. They have a new patient interface or patient viewer interface that our assistants and our team members can share with the patients, and it looks elegant, it looks sleek, it looks crisp, and in its presentation, it's attractive in and of itself. And then they have the back end where we as doctors are doing modifications and continuing tooth movement or treatment plan setups. They've modified their attachment interface whereby you can put in protocols for open bite cases, for class 2 cases, for class 3 cases, for debite cases. So you click a button, all of the attachments appear. Everything that was time consuming for us as orthodontists to set up in our uLab cases in the previous 2 or 3 versions, they've taken again and listened to our feedback and implemented that in their latest update. So again, from the standpoint of, oh my gosh, this is a true partnership with a company that is for orthodontists, by orthodontists, and based on orthodontist needs and wants and feedback. This is where the alignment with a company that you can put your trust in, that if there is something that, I don't like, chances are there's a few of our other colleagues that may not like. The others are impartial, but the company puts time, effort, and research and development dollars into making it better for their end users.
So, Sky, earlier you mentioned a role of your dental assistant or digital assistant. This is a new title that's come into the vernacular of orthodontics. How much of the workflow can you delegate? How much time and energy does it take to get a case started? Could you talk a little bit about how you do it in your office?
Gladly. So the theme and the title of the podcast, actually, the Golden Age of Orthodontics. When I saw this, I'm like, wow, that's truly fitting, because for many of doctors, especially as you get on with your practice and it gets busier, you quickly realize that there's only one of me and there's so many of them, and it's hard for me to be everywhere at the same time and touch everyone, to make sure that the treatment is going well, to monitor. So the role of digital assistants in our practice has become exactly that. If I cannot clone myself, I can at least clone a little bit of my knowledge to our team members who will touch every patient on my behalf. So I feel like the role of digital assistants will truly allow orthodontists to leverage themselves, prevent provider burnout, to ensure that every patient is being taken care of with fresh attention, fresh set of eyes, and the ones that are being flagged as troublesome or they have any difficulties, those are the ones that are being brought back to us for our attention. But leveraging our workflows to digital assistants or even our team members really facilitates that. And I tend to use digital assistants and team members in my vocabulary almost interchangeably. So people use digital assistants differently. Many orthodontists, and I think the way it was initially intended to be recognized, the title of a digital assistant, is when a patient is scanned. So a patient comes into my office, I will provide an introduction to case assessment and what their needs would be. They will already have had a screening panoramic x-ray and a screening scan so that we can use the technology to show the before and after of what could happen. And also the patient has an opportunity to give us their input. Well, I was actually hoping that my two front teeth would be a little bit higher or a little bit lower, a little bit more proclined, and it becomes a meaningful discussion of what can be accomplished, what cannot be accomplished. That patient will then go on and interact with our team member or treatment coordinator, but every team member has an understanding of the digital technologies that we're using. So they will say, you know what, we can only expand as far as the bone allows us. And in terms of treatment planning and setup, doctor, I'd still do my own treatment plans and setups. But the original role of a digital assistant was almost to preset the cases for us, digital cases, aligner cases, so that we would just tweak them. And again, team members, designated team members can deliver those aligners. In my office, I train everybody the same way in terms of the clinical team to have an understanding of how the teeth are set up, what technologies are available, so that the discussion by the treatment coordinator with the initial patient becomes more meaningful and they understand the limitations of tooth movement. The assistant or the hygienist who's placing attachments has an understanding of a digital setup and how the teeth move, and they can show the patient and reassure the patients as to why the anterior attachments are needed. So in my practice, digital assistant is actually a tag that's attached to every team member. In many practices, digital assistants are utilized to set up the cases with the initial setup, and then it's forwarded to the doctor and the doctor just approves it. So I do the initial setup myself. I haven't delegated that part of it. I feel that maybe I'm too much of a control freak, and maybe I will start delegating some of the simpler cases. But where my hygienists do set up refinements, let's say a patient finishes 12 aligner case and they have a little bit of space, my hygienist will understand that they can do a little bit of interproximal stripping click a plus sign and continue to, and they can order 3 or 4 aligners just to close up those spaces. So everybody has an understanding of how digital workflow works and how the tooth movement works. So everybody's kind of on the same page, but again, the initial treatment plan is done by me. The refinements can be done in my office by team members.
Sky, you're a wealth of information, and we really appreciate that you took the time to spend with us and share your experiences with our viewers and our listeners. We'll definitely have to schedule some more time, get you back, because there's so much to talk about. But on behalf of everybody, I want to thank you for taking the time to join us.
It's been my pleasure.
If anybody wants to contact you with a question, for example, what would be the best way to reach you?
Probably the simplest way is to reach me by email. And it's skynaslenas@orthostudio.ca. I'm easily found on the web, Sky Naslenas Orthodontist, and our website comes up. My email is directly on our website. So that's probably the simplest way to do this in this day and age of technology. Everything is available on the internet.
Thanks again, Sky. We will have you back. We appreciate your time, and we'll talk to you soon.
Nice meeting you all. Bye-bye.
You as well. So, as we mentioned earlier in the show, this episode is powered by uLab Systems. And as Sky mentioned, one reason why we like uLab so much is that they offer orthodontists a lot of flexibility. The pay per aligner pricing and the ability to purchase in sprints allows you to treat minor, hybrid, and even complex cases and do it more profitably as well. If you visit the partner section of our website, pplpractice.com, you can sign up for a free uSmile case with uLab. So I encourage you to go ahead and do that. You can subscribe or download other episodes of this podcast on Apple Podcasts, Spotify, or SoundCloud. And if you want to see our faces, check out the video version on YouTube.
Thank you again for watching and or listening. If you want to contact me directly, my email is leon@pplpractice.com. And remember that for forward-thinking orthodontists, it's never been a better time to be an orthodontist. We are in the golden age, but you need to take advantage of it. So until next time, bye for now.
Thank you for tuning in to the Golden Age of Orthodontics. Subscribe now on Apple Podcasts, Spotify, or visit our website at thegoldenageoforthodontics.com for direct links to both the audio and video versions of this episode.